William Gerard Anthony Holohan is an Irish public health physician who has served as Chief Medical Officer of Ireland since May 2008. On the 2nd of July 2020, he temporarily stepped back from his position as Chief Medical Officer due to family issues. Deputy Chief Medical Officer Ronan Glynn was temporarily appointed to the office until his return. In October 2020, the CMRO chairs the National Public Health Emergency Team, a group responsible for the state's responses to the COVID-19 pandemic in the Republic of Ireland, from the beginning of the pandemic until temporary hiatus in early July 2020. Holohan was born in Limerick. His primary education was at Monaleen NS. His secondary education took place at the Christian Brothers School at Sexton Street, Limerick. Holohan graduated from medical school at University College Dublin in 1991. After training in general practice, he also trained in public health medicine, graduating with a master's in public health. Holohan was appointed Deputy Chief Medical Officer in 2001, followed by promotion to Chief Medical Officer in December 2008. Holohan gained prominence during the 2018 cervical check cancer scandal, which involved 206 women in the Republic of Ireland receiving incorrect smear test results for cervical cancer undertaken by the cervical check screening program, and after having been subsequently diagnosed with cervical cancer, not being informed that a review of their original tests concluded that those tests had been read incorrectly. It was reported that Dr. Grainne Flannelly, Cervical Check's clinical director, had advised a gynecologist not to advise women about the re-evaluated test results, but to file the results instead. A number of these women sued the health service executive. Holohan stated that the Department of Health was aware of Cervical Check's stance of not informing some women of the outcomes of reviews into their cases, and that a decision was taken not to escalate the matter to the Minister for Health, telling a review panel, it was reasonable because the information provided in the briefing notes provided by the HSE to the department was evidence of ongoing improvement to how the service was being delivered, rather than the identification of a problem which, of its nature, required escalation to ministerial level. Holohan also said he believed the characterization of the Department of Health of himself and his colleagues by the media had been unfair, telling the committee, the department is far from an organization that is unwilling to seek proper disclosure to patients, that is unwilling to directly performance manage the HSE, and to escalate appropriately to ministers. And any fair assessment of our work record will show that this is simply untrue. The day after, Wikipedia publicly criticized the cervical check program outside the Irish High Court. Holohan felt it was important to address the public concerns about the program, as any delay could unnecessarily undermine public confidence in cervical check. He, therefore, advised in an email to the Minister for Health, Simon Harris, on the 26th of April 2018 to sanction an internal report, prepared by Holohan himself, which could have been completed quickly, to establish the important facts of the case before authorizing an external review of the screening program, which would have taken several months to complete. Holohan noted that there was no evidence at this stage that there are quality or patient safety concerns with the cervical check program. Harris ignored Holohan's advice and ordered an external review. The HSE confirmed that, as of May 16, 2018, 18 women out of a total of 209 women affected by the cervical check program have subsequently died. This number has increased since this was reported. On the 29th of February 2020, Holohan announced the first case of severe acute respiratory syndrome coronavirus 2, the virus responsible for coronavirus disease 2019, and that the resulting pandemic had spread to Ireland. He gave a televised interview to The Late Late Show on the 17th of April 2020.